Hello everyone, welcome back to my YouTube channel. So in today's video, we are going to talk about growth and developmental assessment of toddlers, that is children between 1 to 3 years. So this is a very important stage because children grow and change so quickly during this period. And as nurses, it's really important for us to understand what is normal so that we can identify any delays at an early stage. Well, if you find this video helpful, do like, share, and subscribe to my channel. Alright, let's get started. Now, let us move on to the first aspect, that is physical or biological development in toddlers between 1 to 3 years. So, first, let us talk about weight. During this stage, the child usually gains around 1.8 to 2.7 kgs per year. And by the age of 2 years, the weight is roughly around 12 kilograms. And one important point to remember is that the birth weight becomes almost 4 times by about 2.5 to 3 years. So that is about weight. Next, coming to height, the child grows steadily with an increase of about 10 to 12.5 centimeters per year. Now, if we look at dentition, okay, by around 2.5 years, the child will have complete set of 20 temporary teeth. Moving on to the chest circumference, after the age of 1 year, the chest circumference becomes greater than the head circumference. It exceeds head circumference. So, and this is an important sign of normal growth. Then the head circumference. Okay, so around 2 years, it measures approximately 49 to 50 centimeters. Now let us quickly go through the vital signs. So the average pulse rate is about 110 beats per minute. It can range from 80 to 130 beats per minute. Then the respiratory rate is usually around 25 to 30 breaths per minute. And blood pressure is approximately 90 by 60 mmHg. Then finally, there is a simple formula that you should remember to calculate expected weight. Okay, so the expected weight formula is weight in kilograms equals age in years into 2 plus 8. So yes, these are the important points related to physical and biological development in toddlers. Let's move on to the next aspect, that is motor development in toddlers. Motor development is mainly divided into gross motor and fine motor skills. So first we'll look at gross motor development. At this stage, the child becomes much more active and mobile. You can see that the toddler is able to walk not only forward but also sideways and backward. They start moving quickly from one place to another. Then they are also able to sit on a small chair by themselves. Then they climb on the furnitures. They like to pull and push the toys. They can kick the large ball without falling. They can jump well in place with both feet off the floor. And some toddlers also enjoy riding a walker or a pedal car. Now coming to the fine motor development. Here we see improvement in hand and finger coordination. Here the child can build a tower of about 6 to 7 cubes. Then their scribbling becomes more controlled and they start imitating simple shapes like circular or horizontal lines. They are also able to turn pages of the book one at a time. Then they can open the door by turning the knob. Then they also like putting a block into the holes. And when it comes to daily activities, the child begins to eat with spoon. Okay, then they also play with the food. Then they can drink well from a small glass held in one hand. Then they remove most of own clothing. So overall, during this stage, we can see significant improvement in both movement and coordination in toddlers. The next aspect, that is sensory development in toddlers. During this stage, the child's vision continues to improve. The visual acuity is approximately 20 by 40, which means the child is able to see fairly clearly, though not as sharp as an adult. You will also notice that the child begins to recall visual images, which shows improvement in memory and recognition. In addition to this, toddlers are able to identify different shapes, which is an important step in their cognitive and sensory development. So, overall, sensory abilities are becoming more refined during this stage. Now, let's move on to the next aspect, that is psychosocial development in toddlers. Well, according to developmental theory, this stage is known as autonomy versus shame. Okay, autonomy versus shame and doubt. During this period, the child is learning to become more independent. Well, you will often notice separation anxiety, especially when the child is away from their parents. They may also have difficulty coping in unfamiliar environment. Then at the same time, the child begins to imitate parents. Okay, imitate parents, especially in simple household activities, which shows learning through observation. Then their autonomous behavior gradually increases. They like to do things on their own, but along with this they may also have temper tantrums, which are quite common at this stage. Then another important feature is possessiveness. Okay, so what is this possessiveness? The child may not be willing to share their belongings and prefers to keep the things to themselves. Okay, they do not want to share. So overall, this stage makes the beginning of individuality and independence in the child. So these are the key points related to psychosocial development in toddlers. Now let's move on to the next aspect, that is psychosexual development in toddlers. Okay, according to Freud, toddlers are in the anal stage. Okay, toddlers are in the anal stage. So here the child, how does it derive pleasure? The child obtains sensuous pleasure from the feeling of a distended bladder and release of feces from rectum, which means during this stage, the child derives pleasure from bowel and bladder control. So they may experience a sense of satisfaction from the feeling of a full bladder and also during the passage of stools. And you may also notice that the child shows curiosity about their body, including touching the genitalia, okay, which is a normal part of development at this stage. Next, coming to the spiritual development. Well, at this age, the child is in the stage of intuitive projective faith. Now, what is the meaning of intuitive projective faith? Well, here they begin to imitate religious practices. Okay, for example, you might have seen some toddlers folding hands or bowing their head during prayer. They just imitate the others. Okay, so they are not able to truly understand the meaning behind these actions, but they only follow what elders are doing. So overall, their spiritual behavior is mainly based on imitation rather than actual understanding. Next, we will discuss intellectual or cognitive development in toddlers. According to Jean Piaget, who is a well-known developmental psychologist, so children go through different stages of thinking as they grow. In toddlers, they fall between the sensory motor stage and the pre-operational stage. So you might be knowing that intellectual or cognitive development has various stages. So under that, these toddler fall within sensory motor stage and pre-operational stage. Okay, so first let's understand the sensory motor stage, especially the last part, which is seen around 18 to 24 months. At this stage, the child slowly starts using the mind to think before acting. Okay, so here, instead of just trying things randomly, they begin simple problem solving using mental processes. Also, an important point here is that object permanence is fully developed. Okay, object permanence in the sense, this means that child understands the objects continue to exist even when they cannot see them. Okay, then the child also starts to differentiate themselves from objects around them. Then their attention span is still quite short at this stage. Then we come to pre-operational stage, particularly the preconceptual phase, which is from 2 to 4 years. Okay, so during this phase, the child becomes more interested in symbols, language, and they dream fantasy. You will notice this in their language, play, and imagination. They may engage in pretend play or fantasy activities. They also have a limited understanding of time, like past, present, and future. Then another important development is that the child begins to understand cause and effect, but mainly based on what they directly experience. So overall, during this stage, the child's thinking becomes more symbolic and imaginative, but it is still not fully logical. We will discuss moral development in toddlers. At this stage, the child is in the level of pre-conventional morality. This means their understanding of right and wrong is very basic and mainly based on their own needs and consequences. In stage 0, that is from birth to around 2 years, the child believes that what I like is good. So their behavior is mainly guided by their own desires and preferences. Then in stage 1, which is from 2 to 3 years, here the child starts understanding right and wrong based on punishment. So if they are punished for something, they think it is wrong. And if they are not punished, they assume it is right. Okay, so overall moral development or moral understanding at this stage is very simple and is mainly influenced by rewards and punishments rather than actual reasoning. Next, we will discuss language development in toddlers. Language development can be divided into two parts, that is receptive language and expressive language. First, let's look at receptive language, which means the child's ability to understand. At this stage, the child is able to recognize the names of different body parts. Okay, various parts of the body. Then they respond to simple and familiar commands and can identify pictures of familiar objects when they are named. Then they also enjoy listening to stories with pictures and are usually able to follow two simple commands. Now coming to expressive language, which means how the child communicates. Initially, the child may say around 2 to 6 words, but gradually their vocabulary increases significantly. So they begin to name familiar objects and pictures. Okay, then they also start expressing their needs, sometimes by pointing to objects, but slowly they begin to use more words than gestures. Then they shake head to communicate. You may have also noticed that. Okay, they shake their head to communicate yes or no and start asking simple questions like what is that. Okay, then by this stage the child may know around 300 words. Okay, they may know around 300 words and begins to use pronouns like I, me, mine. Okay, then they are also able to verbalize basic needs such as hunger, then thirst or toileting. So overall language development during this stage shows a clear shift from gestures to meaningful verbal communication. Next, we will discuss play and stimulation in toddlers. Play is very important at this stage because it supports both physical and mental development. First, we have parallel play. So in parallel play, a toddler has a favorite toy, little social interaction with other children. In this type of play, the child plays alongside other children but does not really interact with them. For example, two children may sit next to each other, each playing with their own toys without sharing them. The next is motor play. So here the child enjoys activities that involve movement. For example, playing with the balls, pulling the toys, then they also enjoy activities like swinging, then rocking chairs, then running and the chasing games. So these help them to develop their muscles and coordination. Then comes creative play. So in this the child starts exploring and using their imaginations. So for example, playing with the clay, okay, then finger paints, singing songs, brush paints, that is all about creative play. The next is quiet play. This includes calm and relaxed activities. For example, playing with the stuffed toys. So what is the stuffed toys? That means hugging a doll. Okay, then or sitting and listening to a story with pictures. And many children also like to carry their favorite toy to bed for. They also carry their favorite toy to bed for comfort. Finally, we have dramatic play. So, in this type of play, the child imitates what they see around them. For example, pretending to cook like their mother, talking on a toy phone, then or feeding a doll like a baby. This shows imitation at early role play. Okay, so that is so overall, play during this stage is very important and helps in the child's physical, emotional, and social development. So, with this, we come to the end of today's session on growth and developmental assessment of toddlers. I hope this class helped you understand the different aspects of development in a clear and simple way. Thank you all for watching and being a part of this session. If you found this video helpful, please don't forget to like, share, and subscribe to my channel for more such educational content. See you in the next video. Thank you.